Hi, my name is Madison Salati, and my presentation is on environmental and cultural factors that affect individuals with eating disorders. So, a brief overview on eating disorders. An eating disorder is an eating behavior that negatively affects your health. Some eating disorders that you've probably heard of before are anorexia nervosa, bulimia nervosa, binge eating disorder, rumination disorder, avoidant restrictive food intake disorder, and other unspecified eating disorders. And a couple facts for you. There is 70 million people internationally that live with an eating disorder, and global eating disorder prevalence increased from 3.4% to 7.8% between 2000 and 2018. So it is definitely on the rise. So discussing the media now. So first, the media tends to falsely depict the reality of eating disorders. An example of this is how anorexia nervosa is associated with starvation and weight loss that only affects young, thin, Caucasian females who are from an upper middle class background and are striving for perfection. When in reality, eating disorders are a serious mental health issue that can affect anyone, no matter their race, their gender, their age, their socioeconomic status, and their body type. Second is the media tends to glamorize eating disorders by portraying a thin body as glamorous and beautiful. This ideal body size that is portrayed is unachievable and cannot be attained by the average person. And lastly, the media tries to treat eating disorders less seriously and often uses them for comedic relief, when in reality they can be devastating and without proper treatment can result in serious health issues and death. Next is family support. So family support can either be really positive or can also have a negative influence. So on the positive side, first is families can attend family-based therapy, and this helps to support the affected family member as they work towards recovery. Because when families and loved ones work together to offer support in reaching eating disorder recovery, true and lasting recovery is more likely to be achieved. It's also important for the affected individual to have someone who they can reach out to in times of distress or during triggering situations. So if they have a super supportive family, that is awesome. Family members can also be a positive influence by encouraging the affected individual to get help. A lot of individuals with eating disorders are often too scared to ask for help or feel as if they don't deserve help. So if you're able to provide encouragement to them, you can make a huge difference in their life. So now talking about the negative influence, eating disorders can go unnoticed if a family doesn't have, or if the specific family member doesn't have a close or supportive relationship with anyone in their family. And then when this happens, a delay in treatment can occur, and this is really dangerous because the sooner you start treatment, the better your chances of recovery are. So next is the role of peers. So peers, again, just like family, can have a positive impact and a negative impact. So the positive impact is that peers can help individuals with an eating disorder to seek out help. Many times, again, like I had stated in the slide before, individuals suffering with an eating disorder are afraid to ask for that help. However, if they have supportive peers, they can help them by having a conversation with them about their problem, and their peers can assist them to get the help they need. And peers can also have a positive impact through group therapy. And this type of therapy helps people with eating disorders to talk to each other in a supervised and safe setting. And while doing so, the group members are able to support each other, they can share their experiences, and they can give advice to each other. So on the opposite end, talking about the negative impact, peers can have a huge impact on the health outcomes of those with eating disorders because they can actually influence the development of one, especially in those early adolescent years. Because during those years, individuals are forming friend groups, and they find it important to win this approval and esteem from others. So if their friends are making comments about their body image, there's a risk for dieting and weight loss behaviors. Peers can also influence eating disorders through modeling, discussing weight and eating issues, also called fat talk. teasing, and believing that being thin will increase their likability with their peers. Okay, next is the cyclical nature. So, eating disorders do have a genetic link to them. If a parent has an eating disorder, there's a 40 to 60% chance that their child will develop an eating disorder. And research also states that if a family member has an eating disorder, other family members are 11 times more likely to develop one themselves. And individuals can also have chemical imbalances that relate to hunger, appetite, and satisfaction. And then lastly, temperament traits can lead to an eating disorder, and these include obsessive thinking, perfectionism, and sensitivity to reward and punishment. Okay, so the legal and political system. So NEDA, or NEDA, is a large national political organization that advocates for individuals with eating disorders, and they help by raising awareness, encouraging lawmakers to increase research funding, and educating lawmakers about awareness, prevention, and access to care. And along with many other organizations, it helps this specific population to feel supported and to feel heard. Okay, so potential barriers that this population can run into. A big one is stigmas, and these stigmas include the weight stigma, discrimination, and lifestyle choices. So, a couple things about stigmas is, one, they lead to low self-esteem. Two, they can prevent the individual from receiving proper care and support. And three, they cause individuals to be fearful of negative perception by their family and friends. So, first, discussing the weight stigma, people tend to think that individuals with eating disorders have a super thin body type. However, people of all shapes and sizes suffer from eating disorders. Second is discrimination. People tend to think that individuals with eating disorders that eating disorders only affect young white women, whereas in reality, they affect people of all races, ethnicities, social statuses, age, and gender. And then three is lifestyle choice. People think eating disorders are just a fun lifestyle choice that people choose to do, whereas in reality, they are a mental health disorder that takes complete control over your life. Okay, so next is the international scope. So eating disorders are a worldwide problem, and there isn't necessarily regions in the world where this population would be in danger or shunned, but eating disorders often have a negative stimuli associated with them, so individuals may be teased or bullied. And if this teasing and bullying gets bad enough, it could put the individual at risk for self-harm and suicide. Okay, now jumping to health disparities. So first is socioeconomic status. So symptoms of an eating disorder are equal across the many different levels of socioeconomic status, and studies have been done and indicate that there's actually no association between household income and the development of an eating disorder. And lastly, there's also no effect of employment status on the development of an eating disorder. Okay, next is race and ethnicity. So eating disorders affect people from all demographics and ethnicities. However, men and women who are a part of a minority group are less likely to seek and receive treatment because they are unable to find a provider who can relate to their specific situation. And healthcare professionals really need to be aware of the diversity in eating disorder symptoms and possible underlying mechanisms so that they are able to help assist in planning, screening, and treatment. Okay, next is religion, and for this one, there is a lot of religions, well, not a lot, but a few religions that require fasting. A couple are the Islam, Judaism, and various sects of Christianity. So certain individuals may become obsessive during that fasting period and eventually develop an eating disorder. And an example of this is there was a study done on some patients during Ramadan, and patients had begun restricting or binging or purging before Ramadan, lost several lost the majority of their weight during the holy period, but for some, fasting during Ramadan proved to them that they were able to fast, leading to their continuing use of fasting after the month was over. And for others, the breaking of the fast during Ramadan contributed to a feeling of a loss of control around food, so that led to them purging and more food taken in during this time. Okay, so now talking about gender. So, gender can definitely affect the health outcomes for individuals with eating disorders. An example of this is the LGBTQ community, and due to their gender, many individuals who identify as LGBTQ have a harder time accessing cultural competent treatment, a lack of support from family and friends, and a lack of education about eating disorders among LGBTQ resource providers, and a lack of access to LGBTQ community resources. And also, when referring to gender, men are less likely to seek treatment than women. Okay, geographical location. So this can definitely affect the health outcomes of those with eating disorders. Location of a specialist in an eating disorder. Location of specialist eating disorder services are generally in large metropolitan areas, and rural and remote areas often lack health providers or health practitioners that specialize in eating disorders. So the question is how can we improve? And one way that this issue can be fixed is by training local healthcare workers in the detection and treatment of eating disorders and how to deliver that treatment through telehealth. Okay, some biases. So individuals with eating disorders face many different biases from the population around them. An example of an implicit bias they face is the weight stigma. So this would be something like a nurse or a healthcare provider not prioritizing care for an overweight person like they would for a thin person, which seems so crazy, but sometimes people do develop these implicit biases without even knowing. And then example of an explicit bias they face is the attitudes that individuals might have towards them, like someone stating that they like thin people more than overweight people. Okay, and then health disparities at an international scope. So a lot of these disparities would have less influence on individuals who live in metropolitan areas. I had stated this before, but this was really the only health disparity that I found had a less influence based on where you lived. But these individuals who do live in these metropolitan areas, they have greater access to practitioners that specialize in the treatment and recovery of eating disorders, whereas the individuals who live in those rural areas, they don't have that. So, yeah. And these are my references, and that is the end of my presentation. Thank you.